Hi everyone, I am Jessica and from Fulcrum Aesthetics, and I'm going to be talking about RHA fillers and DAXXI. Okay. So I just have a little bit about me section. So I have over a decade of nursing experience. I worked in the hospital in the critical care unit, also worked in urgent care, and also have worked as a clinical instructor. And most recently, working in the aesthetic space. So I am a board certified family nurse practitioner and sorry, my focus uh, on this would be to give you balanced results. I want you to look like you, just, a refreshed version of yourself. Um, so let me Okay. So now we're going to be talking about the RHA. So it stands for resilient hyaluronic acid. And, traditional fillers are meant to be static. They're meant to stay still and provide volume. But because your face is constantly moving, your filler needs to be able to stretch when you smile. It needs to like snap back. If a filler is too stiff, it could lump or look, create like a shelf when you're expressing. So this filler is meant to, it's a bit more stretchy. It's designed to um, move with your face. So if you think about like a traditional filler being a structured pillow, an RHA more like a high quality memory foam. So it has a higher stretch, better integration than traditional fillers. So that when you smile, it mimics the movement of your face. And then Okay, so now I'm going to be talking a little bit about DAXI. So with DAXXI, this is a newer toxin on the market. It was started manufacturing in the US in 2022, and with this, the reason why I love it so much is because a lot of people with, let's say like if you're getting like Botox or Dysport, they might start to feel like their results start to fade around month three or maybe a bit earlier. With this one, it's kind of meant to last a bit longer. And this is the first peptide power treatment. So the peptide acts like a magnet and it helps it stay stuck to the nerve ending longer. So traditional neuromodulators like Botox or Dysport use human blood proteins, so albumin, to stabilize the toxin. DAXI is the first and only toxin to replace those proteins with a positively charged peptide. So the peptide works like a powerful magnet. Um, and it just kind of creates a positive charge. So the toxin is pulled directly into the nerve ending and attaches more securely. And because of that, it creates like a stronger bond um, for the treatment site. And the other toxins, they could kind of float or wash away more quickly. So that's why DAXI is able to stay in the target area a bit longer. If you think about Botox as a standard battery, DAXXIFY functions more like a long-range lithium, battery. It's designed to last longer, perform more consistently. Um, Here I have a little bit about DAXI versus Botox and Dysport. So, like I said, traditional toxins use the human blood products to stay stable. DAXI uses a unique peptide. So this creates just a magnetic effect. Um, because it's a peptide and it's sort of like a magnet, it often people often report that it kicks in faster, often like 1 to 2 days after treatment. And, everyone's kind of different as far as how long it lasts. But I'd say like if your traditional Botox or Dysport is lasting if you're noticing that it's only lasting like 2 months, this is when I might consider adding DAXI for you. Um, Let me see. So RHA fillers can last about 15 months, and then DAXI may last about 6 to 9 months for many patients. So because these products last a bit longer, don't need to schedule as often. You could come a few, like 1 or 2 times a year, depending on, what you want to achieve. So this is just an example of the RHA portfolio and how I've used it. So this first picture right here, redensity, it's, if you look at the before and after photos, I think this was like before and after, like 3 weeks apart. So if you could see, I placed it along the little superficial lines, and then I also helped around like the like nasal labial folds, just like everything. So I just like kind of put it everywhere, and it sort of just create helped create like a smooth canvas. And then this one you could see RHA2 and RHA3. This is something that I like to put either in like your lips or cheeks. Um, and then RHA4 dynamic volume, it's meant to support areas like around the mid face. So it's really good there because it supports, you know, volume and you're still maintaining that movement. So when you smile, like you're not able to see like a shelf, it just kind of moves with you. So are these injectables right for you? So I would say if you want to look natural, you don't want anyone to know that you've had anything done. I would say that RHA is your best friend. If you feel like your tox is not lasting as long, then I would say DAXXI is a good thing to try. And then, if you have like a big event or anything like that, you want things to like kick in faster, you want to have that nice glow, I would say that this would be a good option for you. So these are some commonly asked questions that I just put together. So since DAXXI lasts longer, doesn't mean if I don't like it, I'm stuck with it longer too. So I would say I kind of recommend DAXXI for those who already know that they love tox. But so you'll like it. Will RHA fillers feel different inside my skin than compared to other fillers that I've had? I would say most patients don't really feel like anything's there. I mean, the first few days you might feel like you're having a little soreness, but it should like all integrate and it shouldn't look anything different. It should look like you just refreshed. And then you can do DAXI and RHA in the same appointment. Um, let's see, does DAXI injection hurt more because it's stronger? I wouldn't say some people complain that there's a bit more of a sting, but I would say it's pretty similar. I've gotten injected with DAXI and I'd say like it feels the same. Um, and then I've heard these are next gen. Does it mean they're more expensive? And with this, I'd say like there's slightly a higher investment on front because of the technology is a bit more advanced and results last a bit longer. But you kind of save in the long run because you're not coming in as often. Okay, so I just wanted to show you a bit more before and after. So over here, I did RHA4 to the mid face or dynamic volume to the mid face. This is RHA3 that I placed in the lips in this middle photo. And then over here, I did use some RHA4 here. And then I wanted to show you this before and after of DAXXI. So Danielle, she's works here. She's lovely, and we did her talks. So she told me she was a high responder for Dysport. So she generally requires like 150 units in her face, and I guess like it barely lasts like 3 months. So we wanted to try DAXXI. And if you see these photos, these first two photos are before and after photos after 2 weeks. And then we did a little tweak here. I don't have the after photo for that because she had a little bit of a raise right here. But we took some photos 2 months after, and this is her results till this point. So for her, Botox Dysport usually kicks in like right at 14 days. She started noticing improvement with DAXXI within 24 hours. So I think we've convinced Danielle to switch over to DAXXI because of those results. And then this is my before and after. So I just got injected with DAXXIFY about 2 months ago. This is my first time since, having this baby, but I just wanted to kind of show you a before and after video. And then, okay. So, if you have any questions, I'm here for you. I would like to offer you a $1,400 off full face balancing filler package with me. You must schedule by May 8th, and just include Jess Masterclass Next Gen in your booking notes. And then, hold on. So, just pulling up some Q&As. So if I'm new to the injectable world, is DAXXIFY a good first choice or only after I've tried Botox or Dysport and built up a resistance? I would say I love DAXXIFY for those who already know that they love tox. So if it's your first time, I might recommend something to start off with something else like Xeomin or Botox or Dysport. Um, but if you already know your dose, you know you want it, then it kind of just depends on what you're looking to achieve. But I would say I would prefer to know that you do like it and prefer to give it to someone who um, is looking more for longevity and maybe those who want like a faster turnaround time with like the how it kicks in. Well, let's see. I have Botox no longer works for me. Could I still use DAXI? So with this, it's kind of a tricky question because I don't know your Botox dose, and sometimes with neuromodulators, like you need to get the right dose. So dose equals duration. So let's say that you're getting an appropriate dose, and you're still like maybe not seeing like longevity from it, then I would switch over to Daxxify. I have had people switch over and have had, their Botox or not their Daxxify lasts longer. So I would just say with that one, it just depends on whether or not we have the right dose for you. And then this is kind of, I have another question. Could I do Daxi and filler in the same day in the same area, like a lip flip and lip filler? Yes, totally can. Okay. All right. Well, thank you, everyone. I guess this is it for the Q&A. But if you have any questions, just feel free to message me. And then again, there's this special offer that's going on until May 8th. So you can go on there. And then next week, make sure to tune in to see Chris talk about the male jawline and facial sculpting. All right. Thank you. Bye.